Hey, everybody. Welcome to today's Coronavirus Tele-Town Hall. This is Congressman Mike Gallagher. I want to start by thanking each of you for joining me today. In particular, I want to thank our special guest for joining the call, the Wisconsin State Department of Health Services Secretary, Andrea Palm. As I'm sure you know, we're here today to answer any questions you may have on the coronavirus outbreak, and we could not be more grateful for Secretary Palm. She is working incredibly hard right now, and so the fact that she's taken time out of her busy schedule to, make herself available to people in Northeast Wisconsin and answer your questions is really something we appreciate and want to thank her for that. One of my most important roles in situations like this as a member of Congress, kind of at the intersection of the federal government and the state government, is to be a resource of good information. There's a lot of misinformation out there, and after today's call, I hope you have a better understanding of the coronavirus response at the federal, state, and local level. And I hope you also leave with more information on ways that you can help slow the spread, because all of us as Wisconsinites need to step up. We're being asked to do something very difficult here, to do social distancing, but we can step up to slow the spread. So quickly, before we get started, I'd like to go over some housekeeping rules. If you'd like to share your opinion or ask a question to the Secretary or myself, press *3 on your phone. That's *3 to ask a question or share a comment. And if you'd like to stay up to date on what's happening in Congress and any legislation I'm working on, click *0 and you can join our email newsletter. So while we wait for people to join the call, I'd like to first share a brief update on what's happening at the federal level. Remember, press *3 if you want to get into the queue to ask a question of Secretary Palm or myself. So first of all, I can't stress how serious the majority of my colleagues on both sides of the aisle and at the state level are taking this threat. Last night, the Senate passed nearly $2 trillion, not billion, $1 trillion bill to respond to the crisis. We're seeing how difficult it is to shut down our economy and how we need to help people who we've forced to shut down right now. But we have to make sure we put small businesses, Northeast Wisconsin, first. There's some good stuff in the bill that does provide support to small businesses, directly to families that are affected. Perhaps the most important part of it, as I've seen so far, and again, we're still working through it in the House, is it has an appropriation directly for those on the front lines, like Secretary Palm and our hospital systems, who need equipment right now. We need equipment to be better able to test. We need basic protective gear, things like that, in order to be able to defeat this disease. And that's actually the best way we can allow our economy to recover. But make no mistake, this will not be the end of our efforts. We have to continue to aggressively do all we can to keep Americans safe. Our federal health agencies, HHS, CDC, FDA, CMS, the Center for Medicare and Medicaid, are working around the clocks to provide updates. We have emergency operations centers set up at the state level to work with FEMA. Really, everybody is mobilizing right now. I can't tell you how many businesses in Northeast Wisconsin have called me, manufacturing companies that have said, hey, I'd like to be able to shift our manufacturing so we can produce masks and things like that. Everyone is mobilizing to try and help out their neighbors and do whatever they can to slow the spread right now. Now, it's not an easy thing to go from normal footing to war footing, and we're discovering some trial and error, that's for sure. But I get a sense throughout the state that people, especially those who work in hospitals, our first responders, are really rising to the challenge right now and doing everything they can. But they need our support. They need personal protective equipment. They need additional resources from FEMA and DOD. They need basic things like masks, respirators. They need certain component parts to do testing. And so that's where most of my efforts have been in the last week. We've been able to get some resources from the national stockpile to Wisconsin, but there's more that we need. And the federal government, I would say, cannot do this alone. The majority of action to slow down this pandemic must come from the state and local level, which again is why I'm grateful to have Secretary Andrea Palm with us this evening, or this morning rather. It's not evening yet. While I've been thinking about this, I think there are three things we can all do as responsible citizens to help prevent this spread. First, and it may sound redundant, but it's still incredibly important, and I think the Secretary would agree, wash your hands. Wash your hands obsessively. Do everything you can to prioritize personal hygiene. Second, stay informed. The state is putting out resources informed by CDC experts every day There are a number of great people you can follow on Twitter and on coronavirus.gov. That's coronavirus.gov. They are always updating the latest information with best practices. And I want you to view my office as a resource as well. So if we can be helpful to you in any way, we're still working throughout this crisis. And lastly, I just would say be a good neighbor. This might be the easiest way for us in Northeast Wisconsin to help. If you have elderly neighbors in particular or family members, maybe offer to grocery shop on their behalf or in order to reduce their exposure. Okay, so let's get into this. For those of you just joining the call, this is Mike Gallagher, and I'm joined by the Wisconsin State Department of Health Services Secretary Andrea Palm to answer your questions and provide information on the coronavirus outbreak. We're going to begin taking calls soon, so if you'd like to share a comment or your thoughts on any issue, press *3. Again, that's *3 to ask a question or share your opinion. And with that, let me introduce Secretary Palm, who most recently served as senior counselor to the Secretary of the U.S. Department of Health and Human Services under President Obama, where she oversaw the public health and human services agencies encompassing more than 60,000 staff. She also served as the Chief of Staff for HHS from 2013 to 2014. Her executive career spans more than 2 decades with a number of key leadership positions. She received her undergraduate degree from Cornell University and a graduate degree from Washington University in St. Louis. So with that, I will turn things over to Secretary Palm. And Secretary Palm, the floor is yours.
Good morning, everyone. Thank you so much, Congressman Gallagher. I am Andrea Palm, the Secretary Designee at the Wisconsin Department of Health Services, and I really appreciate the opportunity to be with all of you today to talk about this important issue and how we're all working together to address it. I know that you all have you had an opportunity previously on a Tele-Town Hall that the Congressman hosted to hear from our Deputy Secretary, Julie Willems-Van Dyke, and so I'm really pleased to be able to be the one here with you today and continue to provide information. So these are difficult times. I want to recognize that right up front. We know that what's going on in the world and here in Wisconsin is stressful and causes anxiety, not just emotionally, not just personally, but economically. But we believe here in this administration, and as Congressman Gallagher said, that working on this together, we really can stop the spread of this disease, and that it's imperative that we do that. As the Department of Health Services, we also think we have a very critical role in being transparent about what we know about this disease, what we're learning about it from other states and other parts of the world, and helping to provide as much information in real time as is possible to help you know what's going on, to help you make decisions for your family and for you so that we can all continue to work on this together to keep Wisconsinites as safe as possible. So our numbers are updated on our website on a daily basis, right around 2 p.m. every day. So I would encourage you to head there in a couple of hours to get today's update. But as of this moment, Wisconsin has 10,089 negative tests for COVID-19, and we have 585 positive tests for COVID-19, and we have had 6 deaths here in the state of Wisconsin. As you've likely seen, and the Congressman referenced this, on Wednesday, and at the direction of the Governor, I did sign our Safer at Home order. The decision to issue this order was certainly not made lightly, but it has become necessary in order for us together to stem the tide of COVID-19. This decision was made by listening to the advice of our public health experts, and it is abundantly clear based on the data that people are safer at home. I also shared some sobering numbers as part of that announcement of the order. Our models are showing us that without intervention, without Safer at Home, we would likely have 22,000 Wisconsinites infected with COVID-19 by April 8th. And as a result of those infections, an estimated 440 to 1,500 deaths. So these models are derived, as I mentioned, by comparing our data, the on-the-ground data that we have here in the state of Wisconsin with the Wuhan, China, and Italy experiences to predict what's most likely to happen here in Wisconsin. And these models are really a fundamental grounding in why we took the steps we did to make it abundantly clear to Wisconsinites that staying home is the best tool that we have to help stem the tide of COVID-19, to protect Wisconsinites, and equally importantly, to protect our healthcare workers who need to be able to continue to work to provide care that is necessary to all of us in this time. So without these actions, we really felt like we were putting our citizens at further risk, and that we would exceed the capacity, the bed capacity of our hospital system, which would mean that folks who need care would not be able to receive it, and we would have worse outcomes. So we really want to do everything we can to protect the healthcare system so that it can take care of all of us. We've been working closely with Frontline healthcare and long-term care providers, and together we are urging the public to take every step that is available to help manage the limited resources that the healthcare system has to take care of patients during this pandemic. Keeping our healthcare system from becoming overwhelmed so it can take care of us is our #1 priority. Remember, there are no medications and there is not a vaccine to protect us from this contagious virus. The only tool that we have is physical separation from each other. And we know the term social distancing has become common, but I suspect most folks had not really heard that phrase before this outbreak. So here's what we mean specifically. Stay at home. Limit your physical interactions to the same people during this time. Less than 5 people total will really help us stop the virus from spreading. Keep at least 6 feet apart from others to avoid direct physical contact. So when you're doing your weekly grocery run, maintain that 6 feet from others in the grocery store, for example. Limit the amount of time you spend out of the house on these essential kind of trips to the grocery store or to pick up your medications by combining those into one outing, and please try to do that no more than once a week. And please, as the Congressman also mentioned, stay in touch with each other over the phone, Skype, FaceTime, the other technology tools that we have to keep family and friends connected are really important as we do this together, right? We all know that humans are social creatures. We are not wired for social isolation, and so our ability to stay connected is important to our ability to stay healthy, and so we really do want to make sure that folks are reaching out in ways that allow physical separation but not social isolation. And as you've hopefully seen, the Safer at Home order does work very hard to recognize the critical role that businesses play in our state, including things like food production and distribution, our fulfillment centers, storage facilities, other parts of the supply chain, and other essential infrastructure. Restaurants can continue to remain open for delivery and takeout as long as they achieve the physical 6 feet distancing requirements. Please review the order, and if you still have questions about exemptions, the Wisconsin Economic Development Corporation, or WEDC, is reviewing those cases and answering questions at wedc.org/essential business. We do recognize that while we tried to be very specific in this order, that an order like this can't cover every single instance, right? It would go on for hundreds of pages if we did that, and so this resource through WEDC to answer specific questions we hope will be helpful to you all and to the public more broadly in the state of Wisconsin as you're trying to make decisions about whether you are an essential business or not. And so beyond our direction to the public, we at the Department of Health Services are also working aggressively behind the scenes with the governor, with our federal delegation, with the State Emergency Operations Center, and our private and healthcare partners to prepare for what is ahead of us. We continue to trace every confirmed case of COVID-19 to find anyone they may have exposed and inform them so that they can go into isolation. Isolation not only means staying at home, but staying in a room away from family members to help avoid exposing them to COVID-19. This is critical public health work, and it will allow us to isolate any people who are potentially exposed. This will help stop them from spreading COVID-19 to more people. And to help do that critical work, we have redeployed 60 public health professionals to aid our boots-on-the-ground public health departments to do this contact tracing. At the State Emergency Operations Center, we also have deployed 6 strike teams, as we call them, which consist of Department of Health Services doctors, nurses, public health officials, and other staff from across our department, working with our healthcare system partners, leaders from Epic Systems, Wisconsin Emergency Management, and the National Guard to plan and execute the work that needs to happen to protect the state of Wisconsin. One of those teams has been focused on expanding contact tracing, as I just mentioned. The other strike teams at the State Emergency Operations Center are working on surge planning, personal protective equipment and other essential medical supplies, lab capacity and testing, isolation facilities, and finally, childcare for healthcare workers. We know that our healthcare workers' ability to come to work every day is predicated on their kids having a safe and consistent place to go. And so we have worked hard to stand up a number of options around the state of Wisconsin and are matching the needs of healthcare workers with available childcare so that we can continue to keep them in the workforce doing the critical work that we need them to be doing for us. And you should expect and be on the lookout for more announcements from these various strike teams in the coming days as we work to continue to keep you all updated on the efforts that we're making here at the state level. I do also want to go back to this important issue that the Congressman raised about taking care of your neighbors, about checking on each other, about staying connected. And that is through actually a U.S. Department of Health and Human Services disaster hotline. They have deployed that hotline as a 24/7, 365 resource specifically to help folks who are experiencing distress during this disaster. And I want you to have that number. It's 800-985-5990. Again, 800-985-5990. And the hotline has trained crisis counselors that are available. And you can also text Talk With Us to 66747 to access this resource. 211 Wisconsin has also been helping to connect people to resources here in the state, and we encourage you to reach out to them if you have questions or need assistance. Other resources to maintain mental health and well-being can be found on the DHS COVID-19 webpage, and I would encourage folks to take the kind of steps that are necessary to protect and preserve your own emotional and mental health during this time, and we certainly will continue to talk about it and be pushing out resources so that people have what they need as we continue to be physically separated but strive not to be socially isolated. And with that, Congressman, I'll stop so that we can get to additional comments or the questions that are coming from your constituents.
Great. Thank you for that. I will exploit my host powers here to just ask the first question. I think a lot of us who have watched countries that have handled this successfully versus those that have handled less successfully have looked at, for example, say South Korea, and it seems that testing is the secret sauce. I mean, that allows you to do contact tracing. It just gives you the data you need to figure out, what's working, what isn't. Just maybe give us a sense, I guess two questions. One, what's your sense of how testing's going at the state level? What are there areas where you need more resources? And then two, let's say I'm an individual who is experiencing symptoms. What advice would you give to that person in terms of whether and how to get tested?
Yep. So let me try to take all of those, and if I forget one of them, please ask me again. So I think testing is a critical piece of this, and we at the state level continue to expand our capacity. We, as of today, are handling about 2,000 tests a day, and continue to work with hospitals and clinical labs around the state, as well as some private sector partners to bring on and continue to bring on additional testing capacity. As with our hospital and private partners and other states around the country, there are supply chain issues with some of, for lack of a more scientific word, with some of the ingredients that are necessary for these tests. And so while we continue to expand capacity as it relates to the machines and the bricks and mortar facilities, we are all constrained by the availability of some of these ingredients that are necessary to run the tests. And everybody is working their contracts and their supply chains to make sure we have what we need, but this is a national problem, and we continue to monitor that very closely as we continue to push and expand testing capacity across the state. So as it relates to that, we have been very conscious of, again, you heard it throughout my remarks and you will continue to hear it, the protection of frontline healthcare workers is paramount to allow them to be safe, to stay healthy, and to continue to do what they need to do as part of our frontline workers in this outbreak. And so prioritizing testing for frontline healthcare workers as well as those who are hospitalized or need hospitalization, so that we can make sure we understand their clinical diagnoses and be able to provide them with the best care that we can. We are making sure that the tests from those groups, the frontline healthcare workers and our most vulnerable, are prioritized while we continue to ramp up capacity. Because one thing we know about this disease is that most folks who will get it their symptoms will be mild, and so what we need folks to do is to be very self-aware of your health, of how you're feeling. Make sure you're thinking about the symptoms of COVID-19 and tracking yourself. Be really self-aware of how you're feeling. So fever, cough, shortness of breath, and then call your provider. Don't just walk into a healthcare facility because you could expose people if you are positive to the disease and continue to spread it. So please call first, have a conversation with your provider about your symptoms, about your underlying health conditions that might make you more vulnerable to severe disease, and make a decision with your doctor about whether you should be prioritized for testing. Most people don't need to be tested. What they need to do is to self-isolate, monitor their symptoms. Obviously, if the symptoms get worse, call your doctor again. But staying home, isolating yourself, keeping away from the rest of your family, and you will recover fully and not divert resources from either the healthcare system or from folks who are more vulnerable to severe disease and need to have priority access to testing. And I think there was a third part of your question, Congressman, that I have not gotten to.
No, that was it. You covered both of them. So I'm going to open it up to those who are in line, and we're going to go to Don, who joins us from the Wisconsin-Michigan border, the borderlands. Don, what's on your mind?
Good morning. Thank you for taking my call. Both doing a great job. Appreciate that very much. My question is, we own a small business, 16 employees, on the border state of Marinette, Wisconsin, and looking at the executive order for the state of Michigan, the stay-at-home is from March 24th to April 13th. The bridge across to Marinette, we're at March 25th or April 25th. I know, how do we handle that for the stimulus program to help our employees? If they live in Michigan, work in Wisconsin, what rules do we follow so we can give them the benefits they need? That makes sense to you.
Yeah, that's a great question. And honestly, I don't know, and I'd ask Secretary Palm to help me out here. I don't know if we have any guidance for how to reconcile Wisconsin's 60-day safer at home versus Michigan. And if not, I would suspect we need to figure that out, because you can't sort of be operating under two different sets of principles. It just would say, as we analyze the Senate bill and potentially vote on it tomorrow, there is a lot, at least in there, that attempts to help small businesses like yours. I mean, specifically a new small business assistance back loan program to help pay for expenses. You can keep your loan will be forgiven if you take it and keep employees on the payroll. Charities, 501c3s will also be eligible for this, and the federal government will forgive 8 weeks of cash flow, rent, and utilities at 100% up to 2.5 times the average monthly payroll. But with that, I'd ask Secretary Palm to maybe just have you heard about any issues like that with different orders for people that may live in Wisconsin or live in Michigan up there on the UP?
So we, and primarily the governor's office as part of this team, have been in close communication with our border states about some of these issues. I think as it relates to stimulus eligibility, I have not read the bill, and so I'm not the one to speak, definitively about that. But I think as it relates to the Wisconsin stay-at-home order and the Michigan or Illinois or others, right, everybody is going to be evaluating the time frames on these orders as this evolves on a daily basis. And so I suspect that we will all continue to work to sync up our time frames, but right, every state is at a little different point in their outbreak, and we just need to make sure that we are helping folks understand the exact kind of questions you have just asked on. But I think for purposes of your own employees, adhering to the Wisconsin order is the safest thing to do for you and for Wisconsin. And then we will continue to work at the state level with our colleagues in these border states to try to be more clear about those issues.
Yeah, Don, let me reach out to my Michigan colleagues, particularly Jack Bergman, who represents that area, and figure out if we can come up with some sort of coordinated guidance. I mean, this is an imperfect answer, but, I guess if your business, and I don't remember what you said, if your business is physically in Michigan, that business is going to have to comply with the Michigan regs. Even if you live in Wisconsin, then when you go home, you'll have to, on a personal level, comply with that. But I still think, let's say you lived in Wisconsin and your business was non-essential in Wisconsin but essential in Michigan, I still think that means you'd go to work the next day. That would be my interpretation. I'm not a governor of either state. But let me work with Bergman to get you a better answer to that. In the meantime, let's go to Sarah in Green Bay. Sarah in Green Bay.
Hello. Thank you very much for this town hall discussion. My question deals with the stimulus package. They've been advertising it as a check for every American who earns less than $75,000. My question is, does this apply to the senior citizens whose only form of income is Social Security plus the dividends or interest from their personal investments? And how does someone who's under 65 reconcile the stimulus benefit to the Affordable Care Act and our premiums for health insurance?
Sarah, that is a great question. So quickly, just to explain how it works, as I understand it, it is a one-time tax rebate check. $1,200 per individual, $2,400 per couple, and $500 per eligible child. It's not reduced for lower income Americans. It's a flat rate. They are reduced for higher income earners, starting at $75,000 for individuals, $112,500 for a head of household, and $150,000 for married couples. It phases out completely at the $99,000 level for individuals and $198,000 for couples, and it extends unemployment insurance to cover gig workers and self-employed non-profit employees. Now, the rub is this, and this is what I'm still trying to work through, and why I think this is maybe a necessary but not sufficient way to do this. It's based on your tax returns from 2018. So if you have to have filed taxes in 2018 and 2019 and be at or below those income thresholds to get the benefits. So yes, I think you would qualify in that case, but you have to have filed taxes in 2018, 2019. But let me get you an answer specifically on the Social Security part of that question. The problem, as I see it, Sarah, is that what if you made, let's say, $105,000 a year in 2018? So you wouldn't qualify for the benefit of the direct check right now. Well, let's say you made that because you owned a small restaurant in Door County and you were doing pretty well. Well, you could be uniquely affected by this crisis right now because no one's going to eat at restaurants. And even though your 2018 tax returns show you as not eligible for this direct payment, you need it. And there may be, conversely, some people that earned $60,000 a year last year and filed as such in 2018. Therefore, they would get the $1,200 check or the $2,400 check for a couple and $500 per child. But they could still have a job. Let's say they work at a manufacturing company, but they're in the front office, or they work in an administrative capacity. They are able to telework during this crisis, and therefore they're still earning a check. Their wage has not been reduced at all. They would still get the $1,200 check, potentially more if they're married and they have children, while that $105,000 a year earner whose livelihood has been completely wiped out does not get the direct check. So as it pertains to Social Security, you can get checks if your only income is Social Security, and if you can get it if you're on Social Security, but you still have to be under those thresholds, right? So if your threshold exceeds $75,000 for individuals, or $112,500 for head of household, or $150,000 for married couples, then your benefit would start to phase down. So it would apply the same to people whose primary income is Social Security right now. But again, that doesn't get at the question of how do you have a mechanism that gets cash into the hands of people that were affected by this unique crisis, regardless of whether they make $60,000 a year or $200,000 a year. Because right now we have people that, could be considered wealthy, right? They may have businesses that earn them $300,000 a year, but in the span of 2 weeks, those businesses are evaporating. And oh, by the way, they are going to have to pay up to 10 weeks of leave for their employees. And so they're proactively having to lay off employees to avoid that. So that's an initial answer to your question. The second part was about Obamacare, and I didn't quite understand that. Sarah, if you're still on the line, could you ask that again? Well, I guess Sarah's no longer on the line. As it pertains to, something at the intersection of healthcare and those who maybe are on Social Security, there is in this stimulus bill an increase in Medicare, if you're on Medicare, reimbursement rates to assist providers caring for people who are in the most vulnerable population. We also increase access to testing by allowing the National Strategic Stockpile to stockpile swabs necessary for test kits. It allows the FDA to quickly approve the use of new medication and treatment. And we basically waived every or almost every regulation when it comes to telemedicine right now in an effort to allow people who need care to stay at home and still get the care they need. And that would pertain to mental health care as well right now. So we're going to go to Paul with a question on essential businesses. Paul.
Yeah, thanks for taking my call. I'm concerned for the employees who continue to carpool to essential businesses that are still open. I contacted my county officials, and they said it's a very fine line for them to tell businesses as what to do and not to do with their employees. I live in a small county where there are very few hospital beds, and my mother and mother-in-law are in their 90s, and I know a couple other old people, and if it goes through here like it does in Milwaukee County, we won't have any beds available for elderly people, and I do believe that state needs to show leadership because the county says they can't do it and don't want to do it, and we should be educating the employers that are still needing their employees to come to work. I think it's a vital deal that's got to happen by the state because the county says they don't want to cross that line. I listened to a doctor from Green Bay on Channel 2, and he's very, very educational. Every day he's teaching people how bad this virus is and how it's going to spread and the importance of social distancing. So I'd like to hear your comment on that. And then my second question is, what about a college-age student? If there's two adults in a household, then what do you get for the child that's he's not a child anymore, he's college age? What are you going to get for that, Congressman? I'll listen.
So, Secretary Baum, could you talk first about kind of the line between essential and non-essential and kind of the thought process therein?
Yeah, so as it relates to the example you offered, Paul, in the order, it's very clear that while essential businesses are exempt for purposes of continuing to operate, that they must deploy social distancing practices as part of what they're doing to protect their employees from the spread of this disease. And so in your carpool example, we would want to encourage that business to help those employees find additional resources so that they could be fewer in a single car coming and going from work. But to your point, enforcement of these orders is at the local level with local law enforcement. And so if employees or others continue to have issues around these kinds of social distancing requirements that are in place, even for essential businesses, I would encourage folks first to start with the employer who may not have full visibility on these kinds of practices. If one guy's driving around picking up other people, it may not be the employer even knows that it's happening. So we should start there and make sure that they understand and are communicating with their employees about the need for social distancing and then helping them solve those problems moving forward.
And to the second part of your question, as I read the bill right now, I do think you have accurately identified a loophole. In other words, if your child is college age and not a dependent, then it depends on whether he's listed as a dependent or not. If he or she is listed as a dependent, I read this as you would be eligible for the $500. But if he's not listed as a dependent, let's say he's 18, 19, 20 years old, he or she would have then had to file for taxes in 2018 to get the benefit themselves. At a bigger level here, I do think you've put your finger on something that concerns me the most. So the threshold, actually, I misspoke at 18. It's under 19 or a full-time. If you're under 19 or you're a full-time student, you can be listed as a dependent, and therefore you'd be eligible for the $500 per child. Above that, you're an adult, and you're treated as, depending on your 2018, 2019 taxes, whether you filed, you could individually have access to the $1,200. However, I do think, look at how this has affected us from the start and the unintended consequences of shutting down, which I'm not saying is not necessary. I totally understand why we do it. We've got to slow the spread. And, that doctor that you mentioned, I don't know if it was Ashok Rai, but, I've spent the last 2 weeks and a half on the phone constantly with doctors, and they all seem to think this is our best chance to avoid further pain down the road is to step up and do what we can to slow the spread. But, we canceled school. We told all these college students, who in many cases were all over the world, right, to come home. In many cases, we're seeing how difficult it is to isolate and quarantine the more vulnerable population because, the grandson or the granddaughter interacts with grandma or grandpa. And now, not only do we figure out how to help families that are now forced to stay home to care for their children and depend upon school to care for them during the day, but it's for college students and for high school students, we can't afford to have them fall further behind. So one of the things that I wrote about the other day is we got to find a creative way where these kids can finish the school year through a combination of online learning, competency-based learning, even extending the school year if necessary, although I know that gets very complicated. But I just would say we can't afford to have a whole semester or a year of school evaporate because our kids are just going to fall too far behind. With that, let's go to our next question. Who is on the line? Cindy with a question on symptoms is next.
Hi, thank you for taking my call. I'm not real clear on what the infectious period is before and after symptoms of the COVID-19, and if we don't get tested, we're home, we don't get tested, how does the state then provide tracing of who we had contact with before we had the symptoms? Another thing is, I think masks are so important for everyone, and I know that the healthcare industry is number one for getting them, but is there any plan from the state for getting more masks so that they're available to the general public? That's all I have. Thank you.
Great. Secretary Palm, can you talk about symptoms?
Yeah, thank you, Cindy. So I'll say a couple of things, and it speaks to the importance of this order and the necessity of doing safer at home in addition to the projections that we have from the model. But one of the things that we are learning over time from the scientists around the globe and who have had outbreaks before us, right, who are on the leading edge of this pandemic, is that you can be contagious with the virus before the onset of symptoms. And so our efforts to have everyone stay home is part of how we break the spread of the disease, break the chain, so that if we are asymptomatic, if we don't have symptoms, but actually do have the virus, staying at home helps really block the spread of the disease inadvertently. And so as it relates to symptoms, what our communicable disease chief medical officer has said is, if you have symptoms and you're trying to decide when you are no longer contagious, when you are recovered, you should be symptom-free. That means no fever, particularly, for at least 3 days, and be beyond 1 week of the onset of symptoms. So, right, it's at least a week plus the 3 days post-fever that you should be tracking for yourself to understand when you are no longer contagious.
And then quickly on masks, I'm sure the Secretary can sort of describe the situation on masks. I just would say that, the President declared a national emergency order under the Stafford Act to provide states with federal assistance from FEMA to address national shortages and things like masks. The FDA has also provided a waiver for what's called NIOSH-approved N95 respirators to be used in hospital settings. The Strategic National Stockpile holds an emergency supply of medical products, including masks. We have requested in Wisconsin the full allotment from the stockpile. The total number of masks that we will receive from the stockpile is about 54,700 N95 masks, and then about 130,300 surgical masks. But that may not be enough. So one of the things we're seeing right now is dentists are actually donating a lot of the excess masks that they have on hand to hospitals that need them right now. Certain manufacturers, you can imagine a roofer and some others use masks in their daily work. They're donating that. We're going to set up a way where if people have excess masks, you can donate them directly to the county here in Brown County. But we're also seeing manufacturers that are trying to step up and produce their own masks in a way that is still FDA approved that can help our hospitals. There's also guidances on making your own masks, and we can share that. We'll put it on our website. There's a lot being done on the mask front, and I'd ask Secretary Palm, how concerned are you about the lack of masks and things like that? And I guess maybe also touch on this. There was this debate early on about whether it makes sense for individual citizens to wear masks or whether they're reducing the supplies that we need at hospitals.
Sure. So a couple of things. Shortages of essential medical supplies. You heard that is one of our strike teams focused on these personal protective equipment and other essential medical supplies that we are seeing supply chain problems with. And I should be very clear that what is in the Strategic National Stockpile is not enough. And we know that, and the feedback we're getting from hospitals and long-term care and first responders from around the state, and what we're hearing from our colleagues in other states is that the Strategic National Stockpile at the federal level is not going to be enough. And so as the Congressman articulated, there are lots of efforts going on, including through our strike team, to find all of the creative ways to bring more essential medical supplies, protective equipment, masks into the state of Wisconsin, and that includes things like working with Wisconsin manufacturers to retool their manufacturing lines. It includes, we announced just in the last day or so, I lose track of time, so I'm not exactly precisely sure, a buyback program for protective equipment. The Congressman also mentioned the donation we received from the dentists, and we are redistributing those surgical masks that they have provided. And so we are all hands on deck as it relates to PPE, but there is not enough. And so it is why it is a high priority for us. It is why we need to do everything we can to put in the hands of people who need this protective equipment the resources we have as quickly as possible. But it is a national problem. It is an international problem in that countries who have suffered this pandemic before us really tap the supply chains. And so as manufacturers are trying to ramp up production to meet demand, it is causing these kinds of shortages around the country. As it relates to individuals, members of the public wearing masks, what my scientists tell me is that it doesn't protect from, in fact, it provides a false sense of security about protection from the spread of COVID, because what happens is this virus, while transmitted by coughs and sneeze droplets, it is also transmitted by it being on your hands, by touching surfaces that are that have the virus on it, and then touching your nose or your mouth or your eyes. And so if you don't have it, having a mask that protects you from incoming droplets is minimally protective considering the amount of times a day we touch our faces. And so the hygiene practices that the congressman mentioned on the front end, washing your hands, not touching your eyes, nose, and your mouth, and doing the social distancing things, the physical separation, so that you are far enough away from anybody who is coughing, are the truest and most scientifically based ways to protect yourself from being exposed to the virus in a way that you could contract it. And so while we continue with every effort we can, every resource we have to get our hands on more masks and more protective equipment, we will continue to prioritize the healthcare system and our first responders, because those are the folks who are most at risk for contracting the disease because of the kind of contact they need to have as part of their jobs with potentially infected people.
Great. So we're hoping to have the buyback website up and live soon, and then my office will promote that. If you're a manufacturer in Northeast Wisconsin and you think you can help with this, please contact me. We can put you in touch with the right people down in Madison. Also, the Green Bay Fire Department and the De Pere Fire Department are accepting donations too, and that includes things like hand sanitizer and wipes. So if you're fortunate enough to have some extra and you want to donate them to our first responders, would really encourage you to do that. The next question, and by the way, there's a larger story here that I won't bore you with about how dependent we are in our supply chain for basic production of masks on foreign countries, specifically China. I do believe when the dust settles, we're going to have to figure out a way to bring a lot of that manufacturing back home here to the United States, hopefully specifically to Wisconsin, but that's a story for another day. Let's go to Richard, who has a question for Secretary Palm.
I called in for a couple of reasons. First of all, I want to compliment all you guys on how the job you're doing and how you're handling all of this and the frontline responders, and how I encourage everybody, the people that are on the front lines, the doctors and the staff and the nurses and whatever, take a chance to compliment them when you see them, because they're under tremendous pressure. The one area that I'm concerned about are the people that are quarantining themselves and they're sheltering in place, and the depression and the emotion. And you brought up a number, a telephone number, and I ran to find a pen and some place to write it down, and I missed that number. So I'd like to get that number from you. But also, I want to bring attention to a website that I launched quite a while ago to form public to private partnerships at the local level, like up here in Door County and Brown County and throughout the state. And if you could go to www.thumbsupacrossamerica.com and make sure you put the word across in there, because there's a lot of other sites that sound the same, but it's www.thumbsupacrossamerica.com. And it's a learning site, and I'm looking at it right now, and if you go there, you'll see Operation Public to Private Partnerships are up to bat, and if you click on Let's Roll, it'll take you to the next page, and it says Operational Period 1, 2, and 3. It's right below me sitting in an inner tube off the Door County shore. You hit operational periods 1, 2, and 3, and it'll take you to how to set up a public to private partnership in your schools, in your churches, and it takes 7 people to do this. And there are 3 operational periods. The first of all, and I think the focus has to stay on sheltering in place and avoiding the spread of the virus and getting a handle on it. But once we get the handle on it, operational period 2 says, how do we get out there and convince people to start buying and shopping locally? How do we get out there and send an internet-based Facebook, social media promotion to get people to come into the county? I'm talking specifically, not right now, about Door County, bring the tourist economy back and get back on track. So that's it. Basically two things. Number one, if you had that 800 number, I'd like to get it out on that website. And number two, I'd like everybody, I put it out in the papers, and I've been trying to get the word out to go to www.thumbsupacrossamerica.com and get involved in forming these local public to private partnerships. And the big thing is each one of them, I mean, any school, what I'd like to see up in Door County, for example, is the 5 high schools get involved in a program, and maybe the band and the football team or whatever, they can form their own 7-person public to private. It's an incident command. I'm sure Mike can tell you all about that, being in the Army. It follows the incident command system approach. So that's it. If I could get that 800 number, I'd be a happy camper. And if I can get everybody to go to www and put www in there, because I do all my own website design, and most people wind up in some foreign, company.
www. Thumbs up across America. Appreciate that. For the record, I was not in the Army. I was in the Marine Corps. Don't demote me. Just kidding, Army guys out there. So what was that 1-800 number, Secretary?
Sure. 1-800-985-5990. 1-800-985-5990. Or you can text Talk With Us to 66747.
Great, thank you. We have a question from Rebecca in Green Bay. Rebecca in Green Bay.
Hello. Yes, I'm concerned about that there is no nationwide coordination of the manufacturing and the procurement and purchasing of supplies and ventilators nationwide. And I understand there's a agency within the military that handles logistics, and it has not been deployed yet. Apparently, it's a defense logistics agency or something, and that seems to be critically important in coordinating what's happening in the country right now. It just seems to be it's a free-for-all, and the states are bidding against each other, competing for the national reserve supplies. They're bidding up the prices of everything against each other. If we had a logistics agency in the military coordinating all of this and allocating everything fairly, I would be a lot less anxious, I guess, that our state, Wisconsin, is going to be outcompeted by New York State, which seems very aggressive, and Washington State, which is, really has its act together, and our little state is going to be left, with an empty bag of stuff. And this has got to get better coordinated. I'm just so frustrated that everything is being left to the states to handle themselves. They're getting some supplies, maybe some things from the federal government, but it's not coordinated. It needs coordination, or we're going to be suffering much worse than otherwise. Can you tell me what?
Yeah, Rebecca, great question about the lack or extent of national coordination, specifically from the military. I do think we saw instances early last week where certain hospitals in Wisconsin, for example, were trying to order supplies for testing, reagent for testing, and felt like that then got redirected by the CDC to, quote, higher priority areas like Chicago. And we don't want to be in a situation where, because people don't think Wisconsin needs supplies, it all gets diverted to New York or California or Chicago. Now, I will say, since then, the Department of Defense has done a lot to deploy resources. They shifted ventilators that they had on stockpile to FEMA to be distributed to the states. FEMA is the agency that is making those difficult decisions on who needs what and where it's going to be in near real time. We're part of FEMA Region 5, which has a lot of Midwestern states. I have also sent a letter to, the President has invoked the Defense Production Act right now. There's been some debate about whether he has fully used all titles of the Defense Production Act. He has used Title I. The subsequent titles he may not need to use if companies that produce things like 3M produces masks give the materials they need. I just would quickly say on the Defense Logistics Agency, indeed it is part of DoD, but don't think of it as a unit you could deploy, like you could deploy the Army Corps of Engineers. And I've encouraged DoD to make full use of the Army Corps to help build surge hospital or field hospital capacity, for example. DLA is sort of just a complex web of supporting actors who are almost constantly deployed in support of everything DoD. So you couldn't sort of deploy it as a separate entity. You could deploy further DoD resources, like DoD has deployed their hospital ships to help New York and other coastal states right now. We obviously can't do that here in Wisconsin unless they want to work their way up the St. Lawrence Seaway. But there is national coordinating happening right now. DoD plays a supporting role, but FEMA is really making those decisions about where resources go. I did, however, send a letter directly to the Secretary of Defense a few days ago asking him to clarify certain parts of the Defense Production Act to get at that national coordination. And specifically, I asked whether the department is coordinating its response across the interagency, including with HHS and the National Response Framework and with FEMA. So we're trying to get better answers on that. I do think everyone's trying to coordinate, and I would ask Secretary Palm to get her perspective. But FEMA is in near constant contact with our emergency operation at the state level. I would also say that the bill, and this is the final thing I'd say, is that the Senate-passed bill does include important funds for helping companies ramp up their production of equipment so that states like Wisconsin can get, the resources we need, and it doesn't go to all other states. This is going to have to be our last question because we've gone over time, and I just want to give the Secretary time to respond to that question specifically, and then anything else she would like to address specifically.
Thanks, Congressman. And Rebecca, I appreciate the question. It is an area where here in the state of Wisconsin we are spending a lot of time and resources chasing leads as it relates to potential suppliers for things that we need, and to your point, competing with others to try to place orders more quickly or try to get in the front of the line, and so it is a place where some coordination would allow us to be more efficient in tackling these issues, and we certainly have heard anecdotally, as the Congressman mentioned, about things that were destined for Wisconsin, whether it's some of the ingredients needed for testing or other supplies. We've heard that those anecdotally that there has been diversion of some of those to other parts of the country, and so we are certainly working hard with our federal partners to get to a place where the coordination is better and stronger. And we here in Wisconsin have also deployed the Army Corps of Engineers as it relates to some of these logistics issues. But it has been a place where there is a lot of static in the system, and where we are concerned about, exactly to your point, Wisconsin not getting what it needs because of diversion to other places. And then I guess finally I would just say, at the Congressman's invitation, I will take it. Thank you. We here at the Department of Health Services and at the statewide response really do want to make sure that the people of the state have timely and transparent information about this outbreak. It is evolving in an hourly kind of way, and so we know that that our role in doing that is critical to making sure that folks understand where we are, why we're doing what we're doing, and to have some visibility about the efforts that are happening behind the scenes. And so I'm very grateful to have had this opportunity to spend time with you all this morning, but I do want to make sure that folks feel empowered by that information and by the kinds of things that we can do to help keep each other safe. And that really is this physical distancing. It is staying at home. It is checking on your neighbors. It is doing the kinds of things that we can to support each other, to prevent social isolation while we are having physical distancing. And so while it feels like there's lots we can't do, I do want to encourage people to focus on what we can do and how we can help each other and work together really to beat this virus, because that's what we're all, right? We're all in this to beat it. And so I'm so grateful for all of your efforts to do that, and we will continue to push information out and to be as transparent as we can about the facts on the ground and the learnings that we are having based on where outbreaks from other parts of the country as well as around the globe, so that we are making the best decisions we can to protect the people of Wisconsin. And so I'm grateful for your time this morning, and to the congressman for allowing us to participate with all of you. And please be safe. Please take care of each other.
Thank you so much, Secretary Palm, for taking the time. Thanks to everyone for joining this town hall. I apologize we went a little bit over time, but really, we just really appreciate Secretary Palm, in the midst of dealing with this situation, taking time to directly interface with us here in Northeast Wisconsin and answer these questions. I think we have a lot of concerned citizens. I certainly think, though, we have a lot of citizens here in Wisconsin that want to step up, want to do the right thing, want to figure out how we protect the most vulnerable, keep our economy alive in the process. And so, I've just seen enormous acts of kindness and graciousness in the last week as Wisconsin has mobilized to defeat the disease. And so, thank you again, Secretary Palm. If you didn't get to ask a question, please stay on the line. At the end of this call, you'll have an opportunity to leave a message, and I'll make sure you get a response to your question. And for those of you who asked a question and we were not able to get to it, rest assured you'll get a response to your question as well. Thank you all for taking time to be on this call. We want to continue to be a resource of good information, not bad information, not misinformation. It's through testing, data, and intelligence that we're going to fight smarter and defeat this disease. So we want to be in the process of passing along good information. So if you want to get in touch with my office, we are working during the crisis. We're doing it responsibly. We're doing it via telework, but we can be a resource in connecting you to a state resource you need or a federal resource. Please click *0 if you want to get on our email list, *0, or visit www.gallagher.house.gov. That's www.gallagher.house.gov. Thank you, everybody, for taking the time. Stay healthy, stay safe, on Wisconsin.